I'm Joaquim Ferreira, I'm a neurologist. I'm also the chair of the local organizing committee of this Congress. And this is the fourth EAN Congress. And then I'm happy to say that this is the largest one. So this is the one with the largest number of attendees. So for someone that in some way started the process, meaning inviting EAN to bring the Congress to Lisbon, it's with great pleasure that my neck is safe, I would say. And what I have promised that is Lisbon, it's an attractive city. There is also I would say a young neurology community, willing to host this Congress. And in some way, just by looking to numbers, I feel happy that really it happened a little bit what I anticipated. It's not just numbers, it's having the possibility to host so many colleagues from all around Europe and all around the world. It's also the possibility to share a little bit of the history of the Portuguese neurology and neuroscience. As I have told during the opening ceremony, this is not the country of Cristiano Ronaldo, even if Cristiano Ronaldo is an important person, mainly for the Spanish now that are suffering a little bit, his competence as a soccer player. But this is also the country of Vasco da Gama, Fernando Pessoa, Egas Muniz, our Nobel Prize in Neurophysiology, Corinne d'Andrade, who for the first time, reported and described new neurological diseases. So this is a country with an interesting history, also in neuroscience. So having the possibility to share that with colleagues, it's really a privilege. On the other hand, seeing that people, I would say, are happy, and happy meaning that I think they are meeting interesting people, they are learning, they are networking, and also this is not just science. The city, it's a nice city. The Portuguese people are full of affection, so we are different. And I think also being able to share that difference and a little bit of our soul, it has been a good sensation for someone that was at the starting moment of this Congress. Being back to numbers, if numbers are not the most relevant aspect, the main highlight is really the size that this Congress is reaching. Mainly because we may be more influential. So being able to say that almost 7,000 attendees were here put neurology in the first level in terms of public visibility. And mainly our main goal is care, it's improve care of our patients. So numbers count. Clearly this will be important for the EAN to put themselves as the neurology face in Europe regarding all the diseases that we are taking care. Then being a generalistic Congress, it's very difficult to select an highlight in scientific terms, also because science nowadays it's different from what it was 10 years, 20 years ago. This is more a Congress for people to be updated. This is more a Congress for people to know exactly what it's happening. The main outputs now are presented, and people from the media know better than I through other pathways. Through the scientific papers, the press releases. So things are planned in a different way. Even knowing so, the EAN, I would say, was clever enough to do a partnership with Lancet Neurology, and for the first time there will be 2 papers that will be released at the same time at the Congress and at the formal press release from the Lancet Neurology website. So at the highlights tomorrow, there will be not just the highlights from the different topics, there will be 2 main scientific results that will be presented again at the same time from the Lancet Neurology perspective and at the Congress. So again, even on that sense, I think the Congress is capturing the way science is being now presented, and clearly it's different from what it was before. Then we have, of course, again the symposium, the main plenary sessions, where the board has the capability to invite giants from neurology, and clearly those giants are people like Professor Mark Allett, that was one of the awardees, and give also a lecture at the Basal Ganglia Club. So again, this is also an opportunity for the younger ones to meet those who they know just by the names in the papers, that they are there, circulating in between us. They are humans like us, and I think it's also a privilege for mainly for the younger ones, really, to know those that they just know from the awardees and the list of papers that they are used to read.